You've come to the right spot. It's another edition of Lewis at Large. 60 minutes of smart talk radio is in your future with guests from all walks of life and all points of view. And now, with this week's edition of Lewis at Large, here's your host, Warner Lewis.
Well, welcome back, everybody. Yours truly, Warner Lewis, as always, from the fine quality flight deck here of Lewis at Large Radio. And, of course, that means Smart Talk Radio is in your future. This segment, no exception. We're going to be talking to Dr. Dennis D. Tirch. He is the Associate Director of the American Institute for Cognitive Therapy, the founder and director of the Center for Mindfulness and Compassion-Focused Therapy. Amongst other things, he's co-authored numerous books and articles on acceptance, compassion, and maintains active research in all of these areas as well. We're going to be talking about a work that he's done recently called The Compassionate Mind Guide to Overcoming Anxiety. We'll dive into that. We'll talk about some holiday depression. We'll talk about just depression in general and anxiety, some things you can do about it, and just understanding the whole phenomena in general. Dr. Tirch, how are you, my friend?
I'm doing really well. Thanks for having me.
You bet. Let's do this. The holidays in general, whether it's at the end of the year or the 4th of July or any time of the year, why are we more stressed then?
Well, a funny little definition of what stress really is that kind of comes from psychological research is the relationship between the demands that we see in our environment and how much we believe that we can meet those demands. And if you think about it, the demands on your time, the demands on your relationships, and even just the demand to be happy and to have a good experience are all ramped up and increased among many other factors during the holidays. So it makes sense that we would experience more stress.
Have you found in your research that the Western world, and let's just say particularly North America, are we worse here than they are around the world?
You know, that's a very, very good point. And I think in some ways, yes. There's a very high prevalence of anxiety disorders in the Western world and, in North America. I think something like 29 to 30% of people will have a diagnosis of an anxiety disorder over the course of their lives. And that's just the people who come forward. That doesn't count people who maybe have extra drinks or self-medicate or don't seek out help. We have a very intense, competitive, and threat-focused society, and that's not really the kind of society that our brains evolved to deal with.
You find that, is there any relationship between socioeconomic class and general anxiety, intelligence, left brain, right brain? Are there some sort of patterns or stereotypes of the kinds of people or groups of people that might be more prone to anxiety than others?
I think that there are going to be variations in terms of who comes forward, but really anxiety is a problem that's sort of baked into all of us. It's first step in really learning to deal with anxiety is to accept and recognize that our finely tuned, always on, better safe than sorry threat detection system has evolved to keep us safe from danger, and it's very, very important. It's an important part of us. The problem comes in the current lifestyles when that threat detection system gets overly stimulated, overly sort of activated, and we don't necessarily learn the best ways to downregulate that experience and to have a sense of safeness and calm.
What about just in general, male, female? Any distinctions there?
Well, it's funny. Women will report being anxious and depressed much more often, and men tend to experience alcoholism and anger and acting out kind of behaviors more often than women, kind of just putting it broadly. So women have a tendency to kind of turn this inward a little bit more than men, where they tend to want to, at least the way we're socialized, the emotional life and their inner lives, maybe that's not really where they go. They tend to want to shut it off or stuff it or, get angry.
What about, let's talk this concept, and again, if you just joined us, we're talking to psychologist Dr. Dennis Tirch. He's the Associate Director of the American Institute for Cognitive Therapy, and let's talk about this concept that you call compassion-focused therapy. Define that for us, if you would, and what that's all about.
I'd be happy to. Compassion-focused therapy is a particular form of psychotherapy that's based on behavioral research, and it's based on evolutionary neuroscience research about how the brain processes emotions. And it's also based on some very old meditative practices that are largely derived from Buddhist meditation, which involve deliberately stimulating the parts of the brain and parts of the mind that feel compassion, warmth, support, and kindness.
Are you how widespread in your profession is this?
Well, in the specific form, compassion-focused therapy, is very widespread in the UK. The founder of compassion-focused therapy, specifically, that kind of movement, his name is Paul Gilbert, and he developed this by working in England with clients who were very difficult to treat, had chronic depression and anxiety with a lot of shame and a lot of self-criticism. Now, in the United States, compassion-focused therapy is really just kind of taking root, but it is a part of a larger, broader movement which is extremely, sort of explosively popular within psychotherapy right now, which is researching mindfulness, compassion, self-compassion, very ancient, actually, methods in all of the world's wisdom traditions that are used to come to a place of peace and calm and be able to step forward into a meaningful life. That larger sort of wave, if you will, of mindfulness, acceptance, and compassion is changing the face of psychotherapy all over the world. And compassion-focused therapy is sort of one of the sort of part of the flow of that wave. It's just a piece of it, but an important piece.
How do you think you're talking about compassion-focused therapy? There's neuroscience. There's the Buddhist psychology, as you were speaking of, behavior therapy. All of these, it's probably desperately confusing to the public. And how do psychologists and the whole psychiatric and psychological community sort of coordinate all of this?
Well, it is a desperately confusing world we live in, and psychologists like sometimes to make it even more confusing. But I love having this part of our kind of discussion. I love talking about this with our clients as well, because very quickly these pieces can come together to create a very understandable whole. And it has to do with how human beings have been designed by evolution to function and to deal with their emotions. So just really briefly, we're a cooperative species. We're not the biggest animal, we're not the strongest animal, but we have this miraculous capacity for language, this miraculous capacity for thought, and a lot of that comes out of the fact that we cooperate and communicate with one another. We have a very, very large brain. It's twice the size, basically, of our nearest primate kind of cousin and chimpanzees, and this brain is designed to feel less threatened, to feel empowered, to feel secure and warm when we're in the presence of loving and supporting others. This is because we're born so fragile. We come into the world like these little helpless little babies, and we have a very low birth rate, and it's very important that we survive. So human beings have evolved this capacity to nurture, to look after, and to support one another. It's very important. And as a result, we know from lots of research in many areas that from the day we're born and throughout our lives, our experience of supportive, loving relationships will affect our psychological well-being, our physical health, our immune system. And this is something that was sort of, in a way, understood for many hundreds, in fact thousands of years, by pre-scientific cultures who developed ways to train the mind to experience affiliative warm emotions, the kind of emotion that you would feel if you had your best friend right beside you, or your father or mother holding your hand and providing you the confidence and security to step out into the world. And what we find is that when we use methods like visualization and sort of mental training to train our minds to experience compassion for ourselves and for others, a wonderful thing happens. Our experience of anxiety becomes more tolerable. Our experience of depression subsides to some extent, and we're able to take control of our lives. So all of these different threads of thought are sort of lenses on this fundamental human capacity to be moved by the suffering of others and to want to do something about it, and then turning that inward so that we can witness our own suffering and consciously and intentionally bring ourselves to a place of calm and courage.
Do you feel that from just a pure scientific point of view, are we making tremendous strides in the field of psychology and understanding more how the human mind really works and what triggers, whether it's anxiety or a wide variety of mental illnesses?
This is a particularly important week, isn't it, Werner, to talk about this because of all the attention to mental health issues and gun control following the tragic events in Connecticut. And when I hear in the media people calling for more mental health research, of course I'm encouraged. I think we do need more funding for mental health research. But something that's conspicuously absent from the discussion is that we need funding for dissemination and implementation, like getting out the stuff that we already know works. We are making tremendous strides in understanding human behavior, in understanding the brain, in understanding what motivates us and how to live healthier emotional lives. Unfortunately, the way, academics and government is structured, it's very tricky to get psychologists talking with each other in different camps, let alone talking with policymakers. So we have made enormous strides, and if you look at the Veterans Affairs medical centers, they're like in many ways a model for how you can take evidence-based treatments and mental health initiatives and get it out there to people. So I think we really need increasing research, and A. B, we have made great strides, and finally, C, dissemination, like getting this into people's hands, is really important, which is one of the reasons that the people in compassion-focused therapy community are writing this series of books, is just to get the word out about how you can get a hold of some of these problems before they get a hold of you.
You are also a clinical professor back east in psychology, and I'm curious, in general, do you see psychology, and I would suppose psychiatry and all the mental health professions, are young people continuing to be interested in this as a profession? And if they are, do you see those numbers going up, planing, or going down a little bit?
Absolutely. I mean, in fact, there's record numbers of people who are becoming psychologists and getting advanced training in psychology and also in social work. And so there's actually more trainees than there are funded internship opportunities. It's actually it's a bit of a problem in psychology training. So funding for additional internships, funding for people's pursuit of psychotherapy, evidence-based therapies is crucial, because there are more than enough young people who are dedicated to take on this work and who are highly skilled and very bright. I'm really honored to work with the trainees at Cornell that I work with, because they're really remarkable.
What about just overall in your career? You've seen a lot of things. Have there been any what you would consider dramatic breakthroughs or measurable breakthroughs, either at the research level or the execution level, that either the general public doesn't really know about or may not be familiar with?
You know, when I have the pleasure of speaking with someone like yourself, I'll often say, that was a good question, or I'm glad you raised that point. And I mean it, but I really mean it right now. That is a really good point, because most people, even really bright people, who are with advanced degrees in their fields, they don't really learn the difference between approaches to psychotherapy. We just haven't gotten the word out good enough. And they don't know that some forms of psychotherapy are much less likely to be effective than others. So we have these wonderful advances in research and dissemination, and they haven't, been really popularized in the way that they could. During my time in training, I've seen cognitive and behavioral therapies and evidence-based psychotherapies, methods that are based on research with a proven track record. They've grown. Our methods have become more specific. And specifically in the last 10 years, practices of meditation, mindfulness, self-compassion imagery, these are some of the best studied psychotherapy methods on the level of brain imaging right up until psychotherapy outcome research. And there's been an explosion in the research and use of these methods. So it's a very exciting time to be a psychologist, and it's a really important time for more people to be aware that they can do something about their suffering.
Just in general, with over the course of your career, you have obviously seen the advent and the proliferation of information on the internet. I'm curious, from your point of view as a doctor, is that a good thing to you, or is that a whole bunch of people possibly self-medicating at a time when they shouldn't be?
Well, it's a tricky one, that. I mean, it's wonderful that the internet gets information into people's hands. However, if we remember Genesis and we remember what the function of the apple in the Garden of Eden was, it was the tree of knowledge in a way, and it gave Adam and Eve the knowledge of good and evil. So with all knowledge, there's a sort of a cost. So if you're an anxious person, part of anxiety is checking to see if you're safe. And so a lot of people with generalized anxiety, chronic worry, hypochondriasis, OCD will really get sucked into checking the internet again and again and again. So like anything else, it's really best used with moderation, wisdom, and self-compassion.
Well, what about, and again, let's kind of go back to, again, if you just joined us, we're talking to Dr. Dennis Tirch. He is many things, not the least of which is he's the Associate Director of the American Institute for Cognitive Therapy. He also teaches psychology as well, co-author of numerous books and articles. We're also talking about the Compassionate Mind Guide to Overcoming Anxiety. And again, let's kind of revert back to the book. Do you see, while it may be more widespread, generalized anxiety, as you were saying, because we have a better handle on it, is it as big of a problem as it was, say, even 10 years ago?
The strange thing is that in many ways it's a bigger problem. We are increasingly exposed to threatening images, competitive images. We're increasingly living in a stressful society. And even though medications and treatment methods become better all the time, there are some strong factors which lead to a lot of people dealing with a lot of anxiety. And the aim of the book, I worked very closely with Paul Gilbert, the editor of the series, to create something that was very friendly, very simple to read, and just like we're talking, just like we're having a conversation, that introduces the nature of anxiety, the nature of the way the human brain functions, and why emotions such as self-compassion and warmth can help us to regulate our anxiety and come to a place of kind of inner strength and courage. And then the book maps out a systematic series of exercises that you can use on your own or with a therapist, and you can download the meditations from mindfulcompassion.com and really sort of take the time to do something about this sort of growing problem, really, of anxiety.
What, and again, I know you're not here we're not trying to dole out medical or psychological advice, but I am curious, just in general, those listeners that suffer from what would be sort of a, if not debilitating, certainly a high level of anxiety. They feel anxious, nervous, somewhat afraid from time to time, or they have family members that they've noticed have this problem. What are some things that they can do?
I think it's good to begin. Well, firstly, if it is possible for someone to work with a compassion-focused or cognitive behavioral or acceptance-based therapist, that would be wonderful. There's resources on my website and links to many places all over the country where people can find help. More practically, a lot of what we do is about slowing down, learning to pause, feel the soles of our feet on the ground, to slow the rhythm of our breathing and kind of take a moment to rest in the breath and deliberately listen to that inner, friendly, supportive voice that is sometimes a bit quieter and less to the fore than our anxious or angry or stressed voices. This involves this quality of mindfulness, which is paying attention in the present moment with acceptance and non-judgment. So just learning to begin to slow down, slow the breath, observe the thoughts, observe emotions, and then kind of like step forward towards what really matters to you. That's sort of where this begins.
Well, Dr. Tirch, as we begin to kind of wind down here, go out 5 years, 10 years in your psychological crystal ball. What you talked a little bit about some breakthroughs, but what do you see as sort of the next big? Is there such a thing as the next big wave, or what psychological issues do you see on the horizon that we're really going to get a much better handle on?
I believe that as we develop better ways to disseminate self-compassion-based interventions and acceptance-based interventions, this is going to be the next big wave. Mindfulness, acceptance, and self-compassion in evidence-based therapies. I've seen this happen a few times. I watched as cognitive behavioral therapy was like a little ripple and became a sea change. I watched as mindfulness changed the face of psychotherapy. And right now I'm watching as compassion as an active process, as something that can be trained, something that literally changes the way the brain is wired, is beginning to spread. And when we can create more compassionate individuals, we can move towards a more compassionate society, a more supportive society, and a more successful way of life.
Well, I appreciate your time today. It is a vast subject. It's sort of out there, big and broad, and hard to really completely harness. But how can people find out more information, not only about the subjects you're talking about, but overall just the Compassionate Mind Guide?
Well, the book is available at Amazon.com, Barnes & Noble, other places online, and Apple iBooks bookstore. MindfulCompassion.com, my own website, would be of course I'm going to advocate for that, but not just because it's my website, but because I've taken the time to put a lot of links there to be your own detective and kind of find out all about what's happening in the world of mindfulness, acceptance, and compassion. So that would be a good place to begin.
All right, listen, again, thank you so much, and best of luck to you, and we appreciate your time.
Oh, it was a pleasure. Have a great day. Thank you.
You bet. We'll be back with more right after this on Lewis at Large.